To put things into perspective, I want you to focus on the ground that these people happen to be standing on. Suppose those standing on the blue side have easy access to higher education, secure housing, and steady income jobs, but those standing on the gray side don't get that advantage. So even if they wanted to come to the blue side, they're stopped by that line of social inequity. Social inequities are what we call the unfair access to resources based on reasons out of our control. Ultimately, the existence of these social divides gives unearned advantage to some people and, respectively, unearned disadvantage to others. And where you stand is further explained in the next slide of the coin model by Stephanie Nixon. Your social location are traits that you're born into and not worked for, like race, sex, social class, gender, religion, and so on. Years of historic oppression and biased policies cause inequities of racism, sexism, and classism. I want you to think about how can your social location impact your health outcome. Unfortunately, who you are happens to impact your access to better income, higher education, food security, more job opportunities, and so on. These all lead to better health outcomes. Not being able to access the same resources as other people are what we call health inequities. Health inequities are consequences of social inequities. Right now, I'm studying population health, and my goal is to learn ways to achieve health equity. The people in this image represent diverse social locations, and the bikes represent fair interventions that allow them each to achieve their full health. Today, I'll tell you who I am, my privileges and biases, to drive home how crucial it is to reflect on your unearned advantages if we want to work towards an equitable world. It starts with biases and associative learning. Over repeated exposure to certain messages, we subconsciously learn how to react to certain situations. News and media have a strong influence in what and how we receive information, so word choice depending on the topic might reflect positive or negative attitudes. We can also develop biases about other people from our family values, early life experiences, to who we follow on social media. Making associations of people and their traits can change how we perceive someone's ability or intent just based on their identity. One example being in media is that light-skinned people are the good guys and dark-skinned people are the bad guys. I am a 21-year-old female university student, born and raised in Canada. I'm a second-generation immigrant to Indian parents, and I grew up surrounded mainly by Caucasian and First Nations people. Socially, I identify more with Canadian culture, but I still live with many Indian values. I have unearned advantage in many ways. I'm a non-religious, able-bodied, straight, cisgendered, non-Indigenous person, so for the most part, the society around me is already structured to my advantage. I speak fluent English, so I'm not judged on my level of competency, and I'm born to a good income family, so I'm able to access healthy food and education. In these two examples, I've explained how biases are multidirectional. Anyone with the opposite social identity I mentioned before faces unearned disadvantage. Being able to afford healthy food and education was luck of the draw to being born into my family, but my class, race, and sexual orientation does not mean I've earned my rights more than other people. I find it hard bringing up my unearned disadvantages, since I sit on the advantage side in so many ways, but the key point about inequities is that they're systemic. Being a woman, no doubt the disadvantages include unfair pay, but we must also consider gaps of research in women's reproductive health, or having to pay for hygiene products that should be available for everyone. After I finish my degree, I might gear towards becoming a health practitioner. So being a cisgendered woman, I must acknowledge how exhausting it might be for a non-straight person to have to come out every time they go to a doctor. Even though I might not think it's a big deal, when I meet a patient, I should offer my own pronouns without assuming theirs to ensure that they feel supported by the system. It's not an intentional error, but sometimes identifying privilege is hard if you aren't working alongside different identities. So I think this photo shows that well, as they only built the escalator for those who look like them, but don't look on the other side where the hill is still causing disadvantage. This could include reducing inequities between genders without including self-identified women or men. People of privilege often feel like they've earned their spot from hard work, and other people don't succeed because they're lazy, and so on. This ends up in a cycle of associating people's worth to how you've perceived them, rather than addressing if they've had secure food, housing, and steady income like you did that influenced their situation. Stephanie Nixon mentions critical allyship, which is the constant practice of acting in solidarity with marginalized groups. If I pursue public policy, I will ensure that I'm not only listening, but supporting people's concerns as we stop assuming health issues based on their stereotypes and rather on the access to resources around them. Now I know this is graphic, but this man represents people in power that show sympathy towards disadvantaged groups without implementing policies to improve their situations. The knife he holds behind him is a metaphor for hiding his privilege. Not acknowledging his power, he's indirectly harming those that he's able to help. When people speak about unearned issues that they face, take a moment to vulnerably put yourself in their perspective and truly listen and change behavior. Discrediting issues of those at an unearned disadvantage only silence their voice. So although you're not intending to hurt anyone, the impact of not acknowledging your privilege to help is still harmful. So what can be done to mitigate biases and increase awareness of other social locations? First of all, education. Since health equity takes into consideration income, housing, food security, and so on, education on recognizing privilege and biases should be included in core curriculums for all students, even outside of social sciences. It doesn't stop there, though. We can feel like we're the most fair people with the best interests for everyone, but ultimately it's whoever is in power to implement the policies for change. That's why it's so important for youth to learn about these issues so that they can teach others and practice allyship so they can elect officials who represent diverse social backgrounds. And would you look at that? I'd like to end this presentation with how we started. Consider again how standing on the blue ground allows you to access resources easily. But now I want you to think of each individual and consider their different race, gender, income, skin tone, religion, and so on. With allyship and education, we can work towards providing equity for all.